Hello everyone, in this video we're going to be discussing some of the differences between the right ventricle and the left ventricle. Now the muscle mass in the left ventricle is going to be much higher than of the right ventricle, and the resting oxygen extraction of the left ventricle is going to be much higher than of the right ventricle. And this should make sense because the left ventricle is much bigger than the right ventricle, so as a result it is going to require a lot more oxygen to carry out its normal functions than the right ventricle because it's just so much bigger. Now, the coronary perfusion is going to happen during diastole only with the left ventricle, and with the right ventricle, coronary perfusion is going to occur throughout the cardiac cycle. And in the next slide, we're going to see a image that is going to nicely summarize this. Collateral circulation is going to be less developed within the left ventricle, and in the right ventricle, it's going to be a lot more developed. And ischemic preconditioning is going to be lower in the left ventricle than on the right ventricle. Now, ischemic preconditioning refers to mild ischemic states that is going to prepare the tissue for future ischemic events. So, with ischemic preconditioning, we have these mild ischemic states that is going to cause changes within the tissue that is going to prepare the tissue better for future ischemic states. And as a result, right ventricle is going to be a lot more prepared for ischemic states than the left ventricle because it has ischemic preconditioning. Now, in this slide, what we see is ventricular pressure in the left ventricle versus the right ventricle. As you can see, ventricular pressure is much greater in the left ventricle than the right ventricle. Because the left ventricle, the pressure in the left ventricle, as you can see over here during systole, is very high. We don't really have blood flowing to the left ventricle during this time. Remember, blood likes to flow from areas of high pressure to low pressure. So, because we have so much pressure within the left ventricle during systole, blood is not going to like to flow there. So, what we see is coronary perfusion is going to happen only during diastole in the left ventricle. When we take a look at the right ventricle, we have relatively low pressure states. As a result, we have blood flowing throughout the cardiac cycle. So we don't have that change that we see within the left ventricle. Now let's go to the next slide where we are going to have a question to nicely summarize the things that we discussed. A 60-year-old woman comes to the emergency department due to substernal chest pain that began 6 hours ago. On arrival, ECG is consistent with ST segment elevation MI. Coronary angiography shows right dominant coronary circulation and a thrombotic occlusion of the proximal right coronary artery, which supplies blood to the patient's right ventricle and the inferior and posterior portions of the left ventricle. A drug-eluting stent is placed and she is discharged 2 days later without complication. After 6 weeks, the patient follows up in the clinic and undergoes echocardiography that shows left ventricular contractile dysfunction with normal right ventricular function. Which of the following characteristics of the right ventricle compared to the left ventricle best explains these echocardiography findings? Now, if the patient has suffered an MI, and after 6 weeks, what we see is we see a damaged left ventricle, but we have a normal right ventricular function. Okay, so the left ventricular contractile we have a left ventricular contractile dysfunction with normal right ventricular function. Now, this is a common finding post MI, and the reason for this is because, as we previously mentioned, right ventricle is going to be much better prepared for ischemic states than the left ventricle, and one of the reasons why right ventricle is going to be much more ready for ischemic states is because it also has perfusion during both systole and diastole. So our answer is going to be C. As we said earlier, because of the high pressure states in the left ventricle during systole, blood is not going to like to flow to the left ventricle during systole. As a result, it's only going to be perfused during diastole, and so it is going to be a lot more susceptible to ischemia because it is only being perfused at a certain time, whereas with the right ventricle, it is perfused all throughout the cardiac cycle. Answer choice B is less ischemic preconditioning. Right ventricle is going to have more ischemic preconditioning than the left ventricle. Answer choice A is less dependence on collateral circulation. The right ventricle is going to have more dependence on collateral circulation than the left ventricle, so it's not going to be these answer choices.